Hadassah Ein Kerem, New Frontiers in Medicine. I'm your host, Maayan Hoffman. As parents, we constantly worry about our children, from their first steps to their first day of school and beyond. And one concern that has grown significantly in recent years is autism. It's a word we hear often, a diagnosis that seems more common than ever, and for many of us, a lingering worry in the back of our minds. I'm a mother of 5, and even as my kids grow older, I sometimes wonder, what if something was missed? What if a diagnosis comes later? Autism, along with other developmental and cognitive disabilities, is something every parent wants to understand better, especially when early intervention can make all the difference. Today, we're joined by Dr. Ariel Tenenbaum, an expert in pediatric disabilities and the head of Hadassah Medical Organization's Down Syndrome Center. He's here to break down what autism really is, how it's diagnosed, and what parents need to know about treatment, support, and the latest advances in early detection, including the role of artificial intelligence. We'll also discuss how the war has impacted children with disabilities and explore the broader landscape of disability care in Israel. If you've ever wondered about the signs of autism, the role of genetics, or how best to support a child with disabilities, you won't want to miss this conversation. So, let's get started. Welcome, Dr. Tenenbaum.
Well, thank you for having me. Thank you.
Of course, now I want to start by defining autism. We often hear this saying, people or so and so is on the spectrum. What does that really mean?
Well, this is a very good question because it has to be specifically identified, and there are criteria that are on the book of that is called DSM-5. It's like the Bible of psychiatry, and there are three main categories. All of them are there in autism. One of them is we are now doing the ping pong of the talk and of the relation. The other one is maintaining friendships and relations with persons. And the third one is the communication abilities, which are verbal and non-verbal. So all of them are typical and are actually mandatory to give the diagnosis of autism. Also, there are some behavioral and environmental aspects, which are repetitive movements or in speech, stereotypes, movements, hypersensitivity or hypersensitivity, and other things that are more of the behavioral and the habits of a person that has autism. But the three main ones that I talked to you about, just mentioned them before, these are the mandatory criteria.
What causes autism? It's something that's genetic, you're born with it?
Well, it's a very big question, and the answer is even bigger because there are so many answers to it. Well, there is a part of the genetic, and there are some rare syndromes that autism is more frequent in them, and some people do have autism because of a specific genetic anomaly. But the environment is very important in autism, and we know that even I think that the classic example is identical twins, in which you can identify autism in one of them, and the other one does not have autism, and obviously they have the same genetics, and they live in the same house, so they are exposed to the same environment, and still we see differences. So there are many questions still ahead of us to understand the full, the answer to your question.
Sure. And I guess the next follow-up question to that would be regarding then diagnosis. How do we diagnose somebody with autism? I've heard there's some new work with artificial intelligence, perhaps, that can help us to get a better understanding.
Yes, especially in the early signs of autism. The average age of diagnosing autism in Israel and in other countries is about 3 years old. But when you go back to the history of the child, you see that the difficulties appeared much earlier. So there are some signs that you can see even when the baby is a few weeks old and months old. If I give you an example that is actually bothering, if a child, like the mother or the father, go to the to the cradle and look at the child in the middle of the night, and child is awake and he does not cry, and he doesn't seem to be bothered with the fact that there's no light and he's alone, and nothing bothers him. So this is one of the phenomena that we see in retrospect, that the mother or the father can tell us about the child, even though he was diagnosed when he is 3 or 4 years old. About AI, this is actually something that Hadassah is involved in. There is a very nice startup that was, there is a clinical study that I'm involved in, and we are working on it in Hadassah. The company is called the Little One Care.
Okay.
And the device, which is actually on sale because they went to production, is called Elora. And it's a really nice device. It's about an inch square.
Okay.
It's not heavy. You attach it to the whatever the baby is wearing. It doesn't radiate anything, and it gets every sound that the baby, the output and the input of sound, movement, and everything that you can even think about what's happening to the baby. So you get a lot of data.
Okay.
And when you get a lot of data, you can try to analyze the data. And then if in a year or 2 years or 3 years, the child has autism, you can go back to the data and maybe find some very, very fine differences or things that pop up when you do a big data analysis, and you can see the early signs. So hopefully this device will be helpful for this kind of kids.
But what would be the advantage if you're waiting till they get the diagnosis? In other words, is this so that we can help other parents in the future be able to identify it? Is that the idea? Because it's not helping to identify it currently.
Right. So this is hopefully the near future. What we need to do is do early diagnosis. In Israel, in the mother and child centers, they do have a questionnaire for mothers. For example, can you calm the baby? If the baby cries, you take him with you, and does he respond to his name? Does he make eye contact? So there are some very simple but actually very effective questions that you can ask the parents and to see whether there are early signs. Now, the early diagnosis in autism and in other intellectual disabilities and other problems is crucial. It's key to the early intervention, and we do see a profit of measures that we take with these kids and the parents.
So when it comes to mild autism, because I know, again, we talked about that spectrum in the beginning.
Right.
If it goes missed, is that such a big deal? Can people live with autism being undiagnosed?
That's really interesting. We ran for 12 or 13 years in Hadassah Mount Scopus a center for the evaluation of disability with the contract with the Ministry of Social Affairs, and thousands and thousands of persons came for the diagnosis. And actually, it's really interesting to see adults that they are 22 years old, 25 years old, and suddenly they think about themselves. They are independent. They live, the work. They live their lives, and they say, maybe I have autism, which is really extraordinary. And they do the diagnosis, and actually some of them are fine to have, the full criteria of autism. So some of them do manage in life, but they can tell you about the struggle and the difficulties. And because there are some treatments and some modifications in life that you can take, I think it is really important to diagnose.
And I definitely want to talk about treatments. I do have one other diagnosis question real fast with regards to pregnant women. Can women today be tested? I mean, I know with many disorders or diseases, certainly Down syndrome, which we'll talk about soon, you can find out before the baby's born. Is that true of autism?
Well, if the mother had already a child or a few children with autism, and there is a family history of autism, and we know the gene, so the mother can be tested. You do amniocentesis, and it can be tested and ruled out or ruled in. But these are not these are not most of the cases. Well, healthy pregnancy is a good thing for the outcome of the child, but other things, well, we're not there yet.
Okay. But you think we will get there at some point?
Well, hopefully, yes. I mean, as you mentioned AI, so if we get a lot of data, and in other cases in medicine, things pop up, and then you see the connections, the relations between some data that you may miss or don't think it's very important, and the outcome of the child. Yeah.
Fascinating. Now, with regards to treatments, can autism be treated for real? Can it be cured ever?
Okay.
And what does that look like?
Well, again, it's very interesting. I treat persons with Down syndrome. It's an absolute diagnosis. I mean, whether you have an extra 21 chromosome or you don't.
Right.
In autism, it's really unique. Some kids get the diagnosis because they follow. You have your criteria, and the child you put a V
Mm-hmm.
on the criteria, and you say, well, the child has autism. Now we start intervention.
Right.
We give him speech therapy, physiotherapy, occupational therapy, parental guidance. We put him in special class, and we do these interventions. And a year later, 2 years later, the child goes again to evaluation. And then you see that he's in another place completely.
Wow.
And sometimes the kids get the diagnosis stretched off their diagnosis, which is like puzzling. I mean, you ask yourself, how can you diagnose a person with a specific DSM-5 diagnosis and then remove the diagnosis? But it does happen in the real
Well,
world.
I mean, wouldn't it DSM-5, because it's psychological, as you mentioned, that's like the Bible of the mental health world. So, I mean,
Right.
with depression, anxiety, can't those things come and go as well?
Uh, I'm not a psychiatrist, but I did read a very nice article about people that are treated for depression for example, with one of the SSRIs
Uh-huh.
medication like Prozac, Seroxat, maybe Cipralex, maybe you know these
Uh-huh.
medications. And sometimes you go to the psychiatrist and get your treatment when you're in the bottom of the situation,
Mm.
of your situation. And then you start the medication, but when you after a period of time, after the trauma, after the bereavement or whatever the person is going through, there is some relief, and the person can like go through a process of healing, and there is the environment and support. So sometimes the diagnosis is made when the person is in the worst of the worst situation that he was, but uh, you can re-diagnose and reevaluate the situation and actually get off the medication if it's relevant for persons. It's also correct for many medications that people take for a very, very long time. And it's interesting to just stop for a minute after like 5 years taking a medication for your blood pressure, but you're doing now sports and you lose weight and you're eating healthy and you're in another place in your life. So maybe you do not need this medication
Right.
anymore. So it is interesting. It goes also with all the diagnoses that you can think about with kids with disability.
So, are there medications that children with autism can take?
So kids with autism do take medication, some of them, but they are specifically for the symptoms that they show. So for autism per se, there are no medications. But if you see a kid who has autism, but also there are signs of ADHD, so you can treat ADHD with medications. If he has anxiety or severe behavioral problems or restlessness or he doesn't sleep, so with these problems, we can deal and we can use the medications. But for autism per se, there are no medications yet.
Wow. Now, what about involvement of schools, communities, parents, caregivers with helping children with autism? What is the recommendation there?
So, first, the diagnosis of autism is on the rise. I mean, you can see it in
Yeah.
all the Western countries and also in Israel. We are talking now about 1 in 40, 1 in 50 kids.
Wow.
So
Is
it's
that,
really a lot.
I'm
Yeah.
sorry to interrupt you, is that because we are now more aware of what autism is, or is that because more people actually have autism?
Well, both. Both.
Oh,
We are obviously more aware. I mean, there are persons that should have be given the diagnosis, and there are older people, and like the missed cases of 20, 30, and 40 years ago.
mhm.
But we do see it's not just the prevalence, it's also the incidence. I mean, you do see the percentage going up, you do see the numbers going up, and we are not sure what we on Earth are doing wrong,
Okay.
but something is happening, and we do see more autism.
Interesting. When we don't, as you said, we don't know. We don't know if it's tied to use of electronics, pesticides, how people are handling their pregnancies, all of these, kind of myths that come out. We don't really have any
No,
answers.
but we are sure that it's not for the vaccine from the
Okay, right.
vaccinations.
I should have named
Yeah,
that first. I
no,
don't know. Yeah, I mean
no,
that's.
it's really important to emphasize this, because there was a few decades ago a horrible article
Mhm.
that was published, and it was done wrong, and they actually deleted it from the journal. And I don't want to repeat all the history about the measles. I know that in the States there is an outbreak now
Right.
of measles, and it usually occurs among persons that are not diagnosed. That measles can be a very, very severe illness with morbidity and mortality. So it's not from the vaccines.
Okay. Now, what about the difference between autism in children and adults? I mean, you mentioned that sometimes adults get diagnosed with autism
Yeah.
later in life. Is there a difference between how you would handle adults or late onset autism, if that's even a thing, versus childhood autism?
It's interesting because one of my colleagues said that there is the Child Development Center, and he said that it should be changed to Human Developing Center, because we are evolving, and the development does not stop at age of 18 or 21.
Mhm.
I mean, we're still learning new things. I didn't use my cell phone when I was 3, because I'm 56 now. So obviously I didn't use the cell phone. So I learned how to use the cell phone. We are still evolving, and we are using different machines and different kind of communication skills, and etc. And our work as pediatricians is very different from what it was 20 and 30 years ago. Now, the basic things are similar, dealing with the communication skills, habits, what's wrong and what's right, environment adjustments, etc. We do see the involvement of persons with autism at work, in the military, in the army,
Mhm.
in Israel, and some of them do very well in all kinds of companies that, for instance, the computers. Okay, so some persons that have autism do work very well in these companies that 50 years ago it wasn't a possibility, because there weren't any, uh, uh, companies and jobs like that.
So I know that your expertise is actually more on children with disabilities, and I wanted to sort of jump over from the autism to children with cognitive disabilities in general. What are the most common ones today? What are we seeing, especially here in Israel?
So Down syndrome is about 1 in 1,000
Mhm.
births, and it's very stable in Israel, and in most Western countries. It's around 1 in 700, 1 in 800. Also prematurity. We are in Hadassah and all around the world. We are doing much better in saving lives of kids who are born very early. But one of the what we see later on is that some of these kids do have problems with their development, and it can be global developmental delay with many areas of disabilities that we are challenged with. Yeah.
So, what should parents be watching for to indicate if maybe their child does have a cognitive disability?
Okay, so if we detect early signs or early risk factors, for example, prematurity or a family history and so on. So we do encourage patients to consult with their gynecologist and with the family doctor. And after the child is born, so there is a very nice system of mother and child centers. Pediatricians are available in the community clinics, and I think that's about it. And also in kindergartens, in schools, there are surveys, and there are persons that come and detect kids with problems, and they send them for evaluation.
Now, this might be a little controversial where I'm going to take this next, but regarding, testing when a mother is pregnant, I mean, you mentioned
Yeah,
before being able to do the amniocentesis and other, disabilities or disorders we can find
yeah.
in advance. Are there ever times that you certainly would recommend to terminate a pregnancy? Is that something that we do here in Israel? And what are the factors that go into making that decision?
Okay, so this is the decision is the mother decides. This is what I believe in. But I do think that the mother is. Uh, I think that my job here is to get the information as clearly as possible to the mother and to a partner, and just to make sure that when they decide, they do it with a clear understanding of what's going on. Some parents did come in different stages of pregnancy. For example, with a child that is, when he will be born, he will have Down syndrome. And they ask questions. We see it and we discuss it. And I don't give a specific recommendation because I think that it's in the mother's hands to decide. In Israel, there are the mother sits with the professionals, and she asks for termination of pregnancy if that's what she wants, and with all kinds of disabilities, physical or mental or cognitive disabilities, these requests are usually approved, and yeah,
It must be very sensitive.
of course.
Since October 7th, I'm going to assume that more children are struggling with mental, behavioral, and other disorders, not disabilities, but disorders, challenges that are resulting in, and even, I guess, physical disabilities for the children that were unfortunately attacked on the 7th down south. And we know how much rehabilitation is going on. Talk to me a little bit about what you're seeing here at Hadassah, the kind of patients, obviously anonymously, that you're treating since October 7th.
Well, some of them, the impact. It's like the how do you call it, the waves when you throw a stone, and
Yeah.
so the waves are still very strong and hitting all of us. Some have mild symptoms like bedwetting.
Mm.
They were, they were dry for a year, and now they're again bedwetting. Just being very alarmed in the middle of the night because of sound of an ambulance passing by, thinking maybe it's a rocket this time. Learning problems, all kinds of anxieties, both the parents and the child. So we see more of that, obviously. Our child psychiatry ward is very busy.
Wow.
With many outpatient clinics, patients that come to the outpatient clinics. It's not only that this generation just recovered from the coronavirus,
Right.
so it's they are challenged. Um, yeah, yeah.
Yeah, hopefully it won't have long-term effects. I'm thinking of my own daughter. I have an 8-year-old, and she, we have so few rockets in Jerusalem, and just from that first day, from October 7th, every time afterwards, she asked me. She, for almost a year, actually more than a year, slept in our bed as a result of the rockets. Just she didn't want to go to sleep, and now she's back in her bed. But she slept in her own bed for a couple of years already. But she kept asking me, "Well, will there be rockets tonight, Mommy? Can you tell me if there'll be rockets?" And that's not a disorder, but it's amazing, the impact that these things have on
No, of
on
course.
everyone.
I have 5 kids. Well,
Oh, me too. There you go. Yeah.
the younger is in the army, so they are not kids anymore. But I do
Okay.
have 3 grandchildren,
Okay.
and the older one, who was 3.5. We went abroad to Cyprus just for a holiday, and we went into the hotel. And he asked, "Where is the safe room?"
Yeah.
And we had to explain that rockets do not fall in Cyprus, but he couldn't figure out how it is possible because his life, he doesn't live in Jerusalem, he lives in Gedera, and they did hear many,
Many more.
many, many
Yeah.
alarms. And they know that in the kindergarten, when the alarm sounds, they have to run to the room. And he couldn't understand how the hotel doesn't have a safe room. So yeah, it's a challenge. Yes, it's
Definitely
a
a
struggle.
challenge for sure. So you think that there's going to be any changes that result in how we treat, children with depression, anxiety, or even cognitive disabilities as a result of the war? Is there new research coming out, anything like that?
There is a very nice article, very nice. There is a well-written article about children in war, in the Nelson's pediatric textbook, which was written by three professors from our department in Hadassah. It appears in the text, the world, the international textbook, and you see what happens with kids at war. So kids are at risk, and kids should never be involved at war. So I am, the notion, the perception, the understanding of what happens with kids that are under stress is documented, and we do see them. Actually, there is um, um, talking about stress. There are three kinds of stress.
Okay.
One of them is the acute, usually mild stress, like you are running late to somewhere.
That's like me every day. So I
Well,
guess I'm always stressed.
okay, so you're running late, or you have an exam tomorrow,
Yeah.
or this typical stress that we deal with them every day, which is fine. And actually, in some cases, you overcome the challenge and you're fine. You did well on the test. You had many patients to see, but you saw them all, and they are doing nicely. That's one. The other one is the more severe and more, but it is still tolerable. When you lose someone who is very dear to you, but he was old and he passed, in old age. So it's very sad. And it can be traumatic, but eventually it's difficult to say, but you just get over it. And sometimes you grow from it. You understand life, and you have some notions and understanding of the circle of life, and or you move to another country, which can be actually
Very stressful.
yes, but in the end of the sometimes a very long time. I'm also an Ole Hadassah. I came from Argentina many years ago.
Okay.
Yes,
I didn't know that.
but eventually you understand the positive effects of it. But there is a toxic stress. This kind of stress is always bad. I mean, if a child is abused, there's no nothing good will come out of it. If the child is at war, if the child loses a parent or a sister or a brother. So these are toxic stress, especially if it goes on and on and on, like kids who are bullied at school, or kids who live in a household that, like, one of the parents has a very severe mental issue. So these are stresses that kids, we do see biologically, that some of them do not recover, and we can show biological markers of the stress,
Like brain biomarkers?
brain biomarkers, but also like they are more at risk of cancer when they are older, more at risk of having hypertension, staying shorter. I mean, growing less than expected. So the effects are, I mean, the impact is very strong. So we need kids to be happy.
It's actually so fascinating thinking about, October 7th and the last year and a half of war. We really don't understand then the long-term impacts. I mean, things, we had a discussion just the other day about the impact on cancer. We're seeing more cancer patients, but from what I'm hearing from you, this is something that we might see in 10 years or in 20 years as a result of October 7th.
Yes, the war is, war is definitely a toxic stress. Yeah.
Wow. Is there anything else that you want to add or you want to share that you think that our listeners and viewers would want to know that we didn't talk about or I didn't ask you?
Well, you mentioned possible treatments for autism, and possible understanding biologically, physiologically, the all kinds of diagnoses and diseases and conditions. And I did want to mention a very nice startup that is also here in Hadassah. That the company is called Itai and Beyond.
Oh, I know it.
Okay.
Yeah. Okay.
So Itai and Beyond, I'm on the advisory board of the company, and they are, I mean, wow, these are really fascinating. We have in the company there are brain organoids, which actually are very mini brains that are in the lab, which originated from patients, from volunteers. And in these mini brains, it is possible to test almost everything. For example, in the future, to see whether medical interventions or kinds of substances or kinds of medications that we didn't think about can make a big change. And what's really elegant that you can do it outside the body. You don't have to test the baby or the child. You can first test it. It's not on animals,
Right.
right? It's just on the small organoid that sits on the lab, and I think it's fascinating. We are now going to, with the company, of course, we are now going to publish the first scientific article. I mean, the results are absolutely fascinating, and I think it's the future. It's definitely a very big part of the future of understanding mechanisms and what works. You can test 200, 300, 400 kinds of substances, medications, molecules, and to see what makes change. It's really interesting.
Wow, it's super cool. And what a great way to be able to end the conversation on such a high note. So thank you so much for sharing your information today.
Thank you. Thank you for having me.
Thank you.